products that can connect to those. And whether those immediately display the information or if they're a gateway to pass it to your back-end web service is really irrelevant from the Bluetooth link perspective, because we allow that information to get transferred. And so you're going to see all sorts of applications that immediately monitor the information. If it's a pedometer and you're walking, you'll be able to look at your watch and see how many steps you've gone. And then maybe when you're done, have your phone upload that information to the back-end website so you can track your progress over time and go like that. So it is really opening up all sorts of new possibilities for how these products are used and how you can collect that information. And by connecting to all those Bluetooth devices out there, the over 3 billion Bluetooth devices shipped, we really can enable that potential. I've been coming to these shows for a while, and there's been a lot of talk, as there has been on this panel, about the aging in place and how we can help with that. And I look at just at the end of last year, my mother-in-law was sick, and she kind of bumped her foot, and it wasn't healing, it wasn't doing right, and she didn't want to bother her kids, she didn't want to go to the doctor, and was in bad pain for many months. And my wife and I live in Seattle, she's in Iowa, so we couldn't go look and things. And it was very painful, the conversations that my wife would have with her and trying to convince her to go to the doctor and stuff. If we could have strapped the heart rate or a body sensor belt on like I'm wearing here, we could have collected the information and showed her, you're not doing what you're supposed to do here. You have to go see it, and convince her to go do that. And finally, she did right around Christmas, and had to have an operation. And I don't think the monitoring would have, stopped that, but it could have prevented that many months of pain and agony within the family leading up to it. And I really think that that's part of the promise of this remote monitoring, to just raise awareness of what you're doing, what your conditions are, and then you can act on them. You can make better decisions. You can't make decisions on things you don't know about. And clearly we want to deliver relevant information to help you make those better decisions. But just that knowledge, I think, helps all of it. And Bluetooth, I think, is going to play a major part of that by collecting the information and allowing the consumer to look at that on all their different platforms, as well as a back-end web server where they can track it. Perhaps their doctor's office can look at it. You can set up automated rules to see, if you're out of regular norms, regular bands, so that then, you can look more closely at it and the like. So we're just on the cusp, really, of where I think this is going and what we're able to do. We're in the pavilion, the digital health pavilion, and there's many different members of the Bluetooth SIG in our pavilion, and around it we're showing a lot of very cool products based on Bluetooth that's starting this revolution. But as I said, we're really at the beginning of it. I think 2011 we're going to see lots of products based on it, and then just continuing to ramp up from there. So it's very exciting times, and look forward to working with the industry to really drive this forward. Thank you.
Michael, is the standard today, the new standard, where you want it to be? Are there other things that need to be done? For example, is the range sufficient? If we're talking about dealing with the elderly, do we need to figure out, can we expand the Bluetooth range? Or are there interference issues or anything else that you would like to see happening in the spec?
Right now, the biggest thing we're working to finalize is all the different use cases, because you have to have the standardized formats for how the information moves between the devices, such that you can buy the monitor and have it work with your iPhone or Samsung phone, whoever's phone. And that we have a few of those done, and throughout the year you're going to see more and more of those coming to enable more use cases. Things like range, power consumption, I think are all good. The initial products based on low energy, the product consumption was actually better than our design criteria. For most uses of products, the product will last longer than the shelf life of the battery, which hopefully isn't longer than the shelf life of the patient
Yeah, yeah.
So, but I think in those areas, in range, same thing. Range you can optimize in Bluetooth depending on the use case. Some you only want short range, some you want longer, and depending on how you build your product, you can enable both those use cases. Things like proximity devices where it locks your PC once, say, your watch gets far away from it. You don't want a real long range with that, whereas home monitoring, you want something that covers the whole house, and Bluetooth is flexible enough to enable both those types of scenarios.
And do we want to see products able to, say, cut off the search for a Bluetooth signal to preserve battery life? Is that something that's important?
Well,
if they're not needing to look for it?
Yeah, exactly, and that's really how you save power, by ensuring that the device is turned off as much as possible. Just turning on, as you said, when it needs to transfer information. And depending on use case, that can be very, very different. I'm wearing a pedometer, and as I'm walking around here, I don't need my mobile phone updated 100 times a second. Once a minute is more than adequate for that use case. Whereas if you're actually in the hospital monitoring somebody, maybe you need it more. So it is use case dependent.
So the question is, we're talking about remote monitoring, but what are the products that are available? And what will be coming online that people can use to monitor various aspects of physical conditions? Our next two speakers are going to talk about that. Jason Goldberg is the president of Ideal Life, a Toronto-based company. And it's interesting to me, if you've been to the show before, you often come to an area, you see a company, and the next year you don't see them anymore. Jason's company is not one of those. I've been watching his company for several years, and he's growing substantially. He's offering a wider range of products. He has a recent big win in China, if you care to talk about that. And I encourage all of you to go and visit his company's booth in the North Hall. And so Jason is the president of Ideal Life, and he is an entrepreneur who translates technologies into workable healthcare solutions. And I think that's all I need to say about you. And I'd like to hear from you, please.
I don't know where to thank you for that wonderful introduction. Great, thank you. So, thanks for having me. So I'll talk to you a little bit about what we do, and hopefully you'll get a better sense of not the hope and promise of telemedicine, remote health monitoring, health-connected devices and solutions, but really see what's in place today, what's available, and the successes that a number of different companies are having today across various different industries. I founded Ideal Life a number of years ago, really with the focus of chronic condition management, and not just episodic, short-term, but long-term sustainable chronic condition management, and the hope of better connecting individual consumers, health consumers, with their care team, be it in a clinical capacity, which in large part, which is what we've been doing the last number of years, connecting physicians, nurse practitioners, caseworkers, coaches with health consumers, better supporting and assisting with that care management. But also with the hope, which is why we're excited to be here for the first time, is really better assisting caregivers with often what's called the caregiver's burden in managing either older parents, elderly grandparents, but what's often not talked about is also young children as well, and really better supporting that interaction. And what's been talked about a little bit has been about the data, and what's most important around that data flow is really connecting actionable, timely, accurate health information that has to be meaningful. And it's only meaningful if we can communicate it to the right people in the right method and manner in which they wish to participate with that data. That information needs to be delivered to various participants in the care continuum. We're talking about people that interact with their trainers at the gym, different specialists, physicians, family members. Everyone is interested in interacting with that information in various different ways. And the two most important factors around that is making sure that that information works in the life flow of the individual consumer, works in that routine daily behavior, not changes behavior as far as accessing the information.